Hey everybody, I'm Dr. Myles Jen Kin. I'm a physician board certified in addiction medicine and emergency medicine, and I serve as the medical director for Recovery Centers of America in Massachusetts. And I just wanted to take a couple minutes to talk about a recent article that was published discussing the rise of cannabis-induced hyperemesis syndrome. And I want to talk about why this is important for not only the patients we treat, but clinicians that might take care of someone with substance use disorder, such as an emergency room doctor, a nurse, an addiction medicine physician, a therapist, a social worker, and education for the general public at large. So the article talks about a rise in the incidence or the number of new cases of cannabinoid hyperemesis syndrome in the emergency departments across the country, specifically in a time period of 2016 to 2022. And they found a significant rise in the number of new cases during that time. And this, interestingly, as an ER doctor myself, this condition was quite rare, I would say 10, 15 years ago. We would see a dozen cases a year. And like the article mentions, over the last 8 to 10 years, the incidence has grown significantly to where I would see one at least once a week in the emergency department. And I think the trend is driven by a couple different factors. Number one, the increase in legalization across the country in different states has given people easier access to cannabis and any kind of cannabinoid product. And the second issue, I think, is that along with this increase in access, the commercial cannabinoid products are more potent than some of the prior cannabis products, from 20, 30 years ago. And what we know about CHS is that it is the frequency and the volume of cannabis that you use that's correlated with the CHS syndrome. In other words, heavy use and especially frequent or daily use is a common thread with the CHS patients. And I think that's paradoxical for a lot of patients in the public at large. And so it's sometimes hard to wrap their head around that. And what I mean is, it's pretty well established that cannabis in small doses or occasional doses can be effective as an anti-nausea treatment and as an appetite stimulator. So when heavy users develop this severe nausea, this abdominal pain, and this uncontrollable vomiting that makes up this CHS syndrome, it's again really hard for them to reconcile that in their head, because it's supposed to be a modality that's treating nausea and stimulating the appetite. But it's not so much the cannabinoids by themselves, it's the volume and frequency that they're taking it that's causing this CHS syndrome. And what's interesting is there's a couple hallmarks of the CHS syndrome that really differentiate it from other types of nausea and vomiting diagnoses and syndromes. And those two things are really important, because there's no test we can run in a hospital or an ER setting to prove it's CHS. There's no blood test, there's no CAT scan or x-ray or anything. It's all based on the patient's history and physical exam. And the two telltale signs that we recognize now is, number one, the patients will almost always tell us that a hot, prolonged shower is very beneficial in reducing their GI symptoms, or sometimes completely resolving their nausea and vomiting symptoms. Obviously, they can't take a hot shower forever, so eventually they stop and they come into the hospital because the nausea and vomiting return. And the second thing that we see is the best treatment, and I would almost say cure, for this CHS syndrome is abstinence from cannabis. And again, that's also hard for patients to really understand that, because they're used to cannabis being associated with anti-nausea properties and appetite stimulating properties. So it's really important that we talk about this, because I think cannabis is often seen as a harmless or even therapeutic modality. And while there are some benefits to it, CHS is on the rise, and that CHS syndrome itself can be very devastating for patients. In the ER especially, we see patients that come in 1 or 2 days after the syndrome started, and they're dehydrated, they're agitated, they're anxious. And not only is that medically concerning, that they might need IV fluid replacement or electrolyte replacement, but it's also, now there's a mental health component with this, with the anxiety and the agitation that comes along with it, that needs to be treated. So some final thoughts to kind of wrap this up here. I think as cannabis becomes more and more accessible and the cannabis products are more potent, we have to be honest about both the benefits and the risks of cannabis as a therapeutic treatment. And cannabis hyperemesis syndrome is real, and it's not about stigmatizing cannabis use. It's just about recognizing this as a true medical condition and recognizing that the best treatment for it, for better or worse, for these patients is to stop cannabis, at least for a period of time, for this syndrome to then resolve itself. So I think some key points here: if you're a clinician, if you're a physician, a nurse, a therapist, a social worker, you work in an ER or an addiction medicine setting, it's really important to keep cannabis hyperemesis syndrome in your mind as a differential diagnosis if you have someone with abdominal pain, nausea, or vomiting, and they use cannabis. And if you're a patient or a family member, just know that heavy cannabis use, especially daily use, can lead to this syndrome, and that stopping cannabis is the path to resolving this syndrome. For those of you that are in treatment with us at Recovery Centers of America, we're here to help you make informed, healthy choices and to support you through every step of the recovery process. Thank you, everybody, for listening, and thanks for caring about this important health topic.